Hi, my name is Catherine Cheng. I am the Program Director for Care Concierge Academy. This video is brought to you by Regain Adult Diapers. Here are some video tips in collaboration with Regain Adult Diapers that I hope you find them useful. Transferring from bed to wheelchair and vice versa. Preparation. Steps to follow. Wash your hands. Greet and explain to the patient to gain trust and cooperation. Raise or lower the bed to a safe working height. Lower the side rails. Place the wheelchair parallel to the bed or at an angle. If one side of the patient is weak, place the wheelchair on the healthier or a stronger side. Lock the brakes of the bed. Lock the brakes on both sides of the wheelchair. Move the footrest out of the way. Put your arms under the patient's shoulders and one below the knees. Bend your knees. Swing the patient's feet off the edge of the bed and use momentum to help the patient into a sitting position. Allow the patient to sit for a few minutes in case the patient feels dizzy when first sitting up. If the patient is doing fine, then move him or her to the edge of the bed and lower the bed to the level of the wheelchair so that the patient's feet are able to touch the ground. Put on his or her non-skid shoes because the floor may be slippery. Pivot turn. If you have a gait belt, put it on around the waist to help you get a grip during the transfer. During the turn, the patient can either hold onto you or reach for the wheelchair. He or she should not wrap their arms around your head or neck. Stand as close as you can to the patient. Reach around the chest and lock your hands behind the patient or grab the gait belt. Place the patient's outside leg, the one furthest from the wheelchair, between your knees for support. Bend your knees and keep your back straight. Count out loud to 3 and slowly stand up. Use your legs to lift and shift your weight from your front leg to your back leg. The patient should help support their weight during the transfer. Once the patient's legs are touching the seat of the wheelchair, bend your knees and move your weight from your back to your front leg to lower the patient into the seat. At the same time, ask the patient to reach for the wheelchair armrest. Ensure the patient is adequately draped and sitting comfortably in the wheelchair.